There are three main things that we want to cover with sports. Those three things include sports drinks, mouth guards, and being prepared for sports-related dental trauma. We want to limit sports drinks such as Gatorade and Powerade as much as possible. Here we have a can of Coke, which has 39 grams of sugar in it. Here we have a bottle of Gatorade, and as you can see, it still has 26 grams of sugar, which is a lot and can still cause cavities. Ideally, we want you to drink water during exercising as much as possible. Other sugar-free alternatives such as Powerade Zero, Propel, and Gatorade Zero do not have added sugars but are still really acidic, which isn't great for your teeth. We encourage wearing mouth guards for all contact sports. The sports that have the most associated dental injuries include basketball and baseball. While your child is still losing teeth, either a stock or a boil and bite mouth guard is going to be the easiest. If your child does not tolerate the stock mouth guards well, when all the permanent teeth are in, we can consider making a custom fit mouth guard. Most children report that custom mouth guards are more comfortable and make communicating and breathing easier. Lastly, I want to go over what to do if there's a permanent tooth trauma. The three main categories of dental trauma are chipping teeth, displacing or moving the teeth, and knocking the teeth out. Regardless of the injury, you should call our office to describe the type of injury and schedule an emergency exam. We always have a dentist on call here, so you will be able to reach one of us even if it's after hours. After the injury, you should start having your child take ibuprofen every 6 hours for both pain relief and for anti-inflammatory properties. And you should also have your child stick to a soft food diet for the next 10 days. If your child's tooth is knocked out completely, this is the most time-sensitive dental injury that there is, and there's some things you need to do before reaching the dental office. First, you want to find the tooth and rinse off any debris. You can do this by holding the tooth by the crown, that's this part right here, and then very briefly running it underwater. Then, holding the tooth by the crown, you want to push the tooth back into the socket. If it doesn't go back perfectly, that's okay. Putting the tooth back is going to help the cells surrounding the tooth survive. You can put a napkin or washcloth in the child's mouth afterwards for the child to bite on to hold it in place until they reach the dentist. If for some reason you can't get the tooth back in the socket, you can store the tooth in cold milk until you reach the dental office. But always remember that putting the tooth back in the socket is the first choice and will have the best outcomes. It's also important to note that should a baby tooth be knocked out completely, you do not want to put it back in the socket because that risks damaging the permanent tooth.